There.
Well, yeah, my whole body fell, right?
Yeah.
Again.
So left QL is super, super checked up.
Oh, yeah.
SI joints are both moving fairly well. Left a little stiffer than the right, but
Yeah.
it's not brutally unhappy. I'm just going to bend your knees up.
Yeah.
Being careful to not touch your foot. And bending better on the right side. And then I'm going to ask you to go whole right leg up as high in the air as you can from here, Sarah. Good. And whole left leg up as high as you can there. Good. Pretty even there, actually. Bring you up here. I'm going to ask you to curl up into my hand. Good. And then I'll switch sides. And curl up into my hand. Also quite good. Now, if I give you some pressure through the SI joints, that's a little more challenging. And I'm going to bring you up here. I'm going to have you relax here. Feet are going to fall out to your side. And you're much better able to rotate internally through that right hip compared to the left. So a couple adjustments in through here. I'm going to get you started facing on your side towards me this way.
Right here?
You betcha. As long as it's comfortable for you. You can go ahead on the headpiece too if you want to be up a little higher. Bottom leg's going to straighten out.
Okay.
You're okay like that?
Yeah.
Perfect. There we go. And then I'll get you on the other side. Get you here, get you here. Lay back just a little more. Perfect. Are you going to be okay with your foot up?
Yeah.
Good. Good, and then I'll get you back face down for me.
Okay.
And so this time, if I bend both knees up, much more even there.
Nice.
And if I challenge your SI joints and you curl up into me, that doesn't cause any issues anymore. Still more tone on that left QL. So I'm going to test the right actually. I'm going to bring both legs over to your right.
Yeah.
And I'm going to try and pull you back to the center. Can you hold me over to the right? Not super well. Okay. So we'll challenge the lymphatics there, and that does not seem to help. Try that again. No, not much. More right in through origin insertion. Hold those over. Okay. So you get to relax there and just gently push down there. So we'll work on the tendons of that QL. Pressure okay in there?
Oh, yeah. Yeah, it was quite the fall. I called my dog.
Oh dear.
I was killing a bug above the window, and then as I went to step down, he like lunged to where I was going to step, and then very quickly backed out, and I went flying.
That's too bad. Not a fun way
No,
to go down.
not at all. I mean, the baby lost her mind.
Of course.
So dramatic. That light pod is really nice.
It is a great, great thing. I'm going to get you hold me over there again. And I'll switch you. Same thing over to the left this time. Left is fine. Perfect. Now for you, lots of stiffness in through the T-spine as well.
Oh yeah.
I'm just going to adjust through here. Nice deep breath in. Perfect. Beautiful. And then same thing. Good. Yeah.
A little sticky.
Little stick. So I'm going to borrow your head here.
Yeah.
And perfect. So with all that, I'm going to bend both knees up. And again, still bending nice and even, a little bit smoother too at this point.
Right.
Whole right leg up as high as a little for me. Good, and then left. Good. Nice and even there. If I bend both knees up, I'm going to have you relax, let your feet fall out to the side. More even in that internal rotation. Well, I'm not convinced I'm thrilled with it. Are you okay if I check right in through the glutes?
Yeah, oh God, please.
Oh yeah, okay.
Oh my God.
So, let's grab the, I think percussor is going to be the friendlier way for you to do this.
Yeah. Ah, crap. It's so needed.
And so I'm just going to get right in there. You okay like that?
Yeah,
Okay.
I can take it.
We'll do some pin and stretch with the percussor here too.
Ooh,
Sorry.
that's okay. Well, my right is so much worse than my left.
Can't say I'm shocked.
Oh my God.
Try and breathe. Bend both knees up here. Have you relax. Feet are gonna fall out. That's better. If I recheck right in through the hips. Oh, that's definitely better.
Mm-hmm.
Okay, good. Alrighty. Let's get you on your back when you're ready for me.
I'm so relaxed now.
Perfect. A little higher there. And then, if you don't mind, I'll actually get you scooched just a little further back onto the headpiece here. You okay like that?
Yep.
Wonderful.
My neck is such a mess.
Mm-hmm. I am definitely feeling that.
I have no lateral flexion. Well, maybe when you do it.
Well, one way, but not really the other way. There's a huge difference there. Rotationally, not too bad. Little bit better, smoother end range. But yeah, significant lateral flexion restrictions in there.
Big time.
Yes. Fix that. And then what we should see, yeah, that range is much, much better. Very awesome.
You should see me when I try to demonstrate active range of motion in the neck for my clients.
I have days like that too. This is exactly what it's not supposed to look
You
like.
should be able to do this, but like twice as much.
See how this side moves? Your other side should do that too.
Oh my God, that left side.
Mm-hmm.
I feel it in my throat, and my eye, and my mouth, and that's great.
Lovely. Now, headaches for you lately? Like you can get even behind the eye where you're
miss.
feeling it? Hit or miss?
Hit or miss. You know what? I've been so busy. I've been falling asleep at like 8:30 at night and waking up at 5:30. I've been so busy to even notice. But yeah, probably a little.
Okay.
That's
2 years of it having to do. Yep. You're okay with the traction though?
Oh yeah, I was just making sure you did. Can you feel
Yep.
things moving around?
I can actually.
It feels so weird.
It does, and I'm not giving you a lot there. Are you able to pull up into dorsiflexion here? Yeah. And
It
then-
worries me. They only did an X-ray of the like very tip of the 4th and 5th, so I'm surprised they
Oh.
caught it. And I'm like, what about the rest of my foot?
Fair. Are you feeling anything as I'm doing
No
it?
pain, just
Okay.
the like crickety
Yeah.
crackety.
Lots of clunkiness. Press down into me here. Any issues there?
No.
Okay.
And the bruising wasn't too severe either, that's why
Okay.
it kind of made me a little calmer, but I worry about that base of the fifth.
Yeah.
But I don't have pain there. I've just been getting a lot of referring pain into my arch.
That unfortunately makes some sense.
That's good. Oh,
There we go.
that's good.
Anything else in through, I mean, I'm not venturing much into the forefoot right now, but midfoot,
Yeah.
rear foot, all feel now like they're moving pretty well.
Yeah, that last little adjustment felt really, really, really nice. It was like everything just slid back into place. And this poor foot.
Well, it's been doing the brunt of the work, I'm
All
sure.
the work. I've been overpronating on the left so much, it's crazy.
Yeah.
There's no way to avoid it.
No. No, there's not right now, you're right. Can I get you to adduct into me here? Please, perfect.
You're so much stronger.
And then press apart. Good. I'm gonna have you kick up into me here. Is that the ankle?
Yeah.
Okay. Try that one more time. Yeah, as long as it was one off. And then again. Good. I'll have you bend both knees up for me. Squeeze here. Good. Push apart. Good. You get to relax there. I'm just going to check in through the knees as well. Good. 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 Little off there. Pressure okay? Alright. It's moving better, just not loudly. And actually, I'll swing around behind you. I'm going to check shoulders with you.
Yeah.
Where are you here? There it goes. Bonus elbow. Then I'll switch you here. Good. And then push up into here. Pull down. Good. Switch you. And push up. Pull down. Good. And then I'm going to grab just your right hand here. Try and flip your palm up. Keep me here.
Oh wait.
Yep. There we go. And then we'll go the other way. Perfect. Curl there. Good. Pull that back. Or more into like extension. There we go. I can use the technical terms. And then pinky thumb in opposition and hold. Good. Fingers all straight and squeeze them together.
Stupid pinky.
As best we can. Good. That holds at least, and then push them apart.
That's like 20 years of
Hey, yeah, it's
working
doing
out so far.
something.
There we go. Oh yeah, part of it works.
Hey, there we are.
Uh,
Grab you here and open palm for a second, then I'm going to try and,
there
yeah, and then we'll go the other way.
you go.
Good. Flex up, and then extend back. Good, and then opposition, pinky and thumb. Good. Fingers all together and squeeze. Or straighten
Sorry.
together, I apologize. Yep. And then apart. Good. 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 All right, feel that all out. Let me know how you're doing.
One little guy in here.
You feel like that?
Yeah, ulnar deviation pinchy. Just a wee, maybe. Maybe it's more.
I think that'll do it.
Yeah.
All right, I'm gonna get you to lean back for me, just slightly.
Oh,
Jeez.
all
All
right.
right, try that for me. That should.
Yeah, that feels better.
Perfect.
It was so subtle. It was like, yeah, amazing. And yeah, my hands don't hurt anymore. I think I just needed to get over being pregnant.
I mean, it takes its own toll on you for sure.
Yeah.